Medications are an essential part of treatment for many conditions. As a parent, you want to be sure that your child receives the safest and most effective treatment. Knowing which questions to ask your child's doctor can help you make well-informed decisions. This video summarizes the important questions to ask your doctor about the medications prescribed for your child. Hello and welcome to Pediatric Doctor at Home by a board-certified pediatrician providing practical medical tips for parents and caregivers of children and young adults. Here are some essential questions every parent should ask about their child's medications. What is this medication for? Understanding why your child needs the medication is the first and most important step. Every drug has a specific purpose. Sometimes medications are prescribed to treat symptoms, while other times they address the underlying cause of an illness or manage a chronic condition. Ask the doctor about the condition or symptom being treated and why this particular medication is recommended. What side effects should I watch for? All medications come with the possibility of side effects. While some may be minor, like drowsiness or an upset stomach, others can be more serious. It is important to know what to expect, so ask your doctor about the common side effects and if there are any rare but serious side effects you should be aware of. This will help you keep an eye on your child's reaction to the medication and respond quickly if anything seems wrong. What is the correct dosage and schedule? Given the correct dose at the right time is crucial for the medication to work properly. Make sure you understand how often the medicine should be taken and whether it needs to be given at specific times, such as in the morning or before bed. Also clarify how long the treatment will last. Stopping a medication too early, particularly antibiotics, can lead to the return of symptoms or even resistance to the drug. Can my child take this medication with other drugs? If your child is already taking other medications or supplements, it is important to check for any potential drug interactions. Be upfront with your doctor about everything your child is taking, even if it's an over-the-counter remedy or a vitamin supplement. Some medications can interfere with others, reducing effectiveness or increasing the risk of side effects. Ask if the medication will interact with anything else your child is currently taking, or if you should avoid any foods or supplements while your child is on the medication. Should the medication be taken with food or on an empty stomach? Some medications work best when taken with food, while others might need to be taken on an empty stomach to be effective. Are there alternatives to this medication? Sometimes there may be alternative treatments to the medication being prescribed. This could include lifestyle changes, over-the-counter remedies, or other prescription options with fewer side effects. It is always good to ask whether alternatives are available and whether they would be appropriate for your child's condition. What is the brand name and the generic name of the medication? Medications come with both a brand name and a generic name. This is useful to know because pharmacies may dispense the generic version, which can be less expensive but equally effective. By asking these questions, you can ensure that you are administering your child's medication in a safe and effective manner. Being proactive in your child's healthcare empowers you to give them the best care possible. Always remember, your child's doctor is there to support you, and no question is too small when it comes to your child's health. I hope you learned a thing or two. Thank you for watching, and don't forget to subscribe.